I might just give it another couple of seconds to let people join. I think we've still got a few. Okay, well, I think the number of attendees is slowing down, so hopefully that means everyone who's joining us will be here soon. So hopefully you can hear me, and hopefully you can all see my screen, which says ground rules and housekeeping. It's just struck me now that housekeeping means something a little bit different while we're all working from home. I promise not to do my hoovering while I'm doing this demo, but just in case anyone else is tempted to do their hoovering, we're going to ask that everyone goes on mute, and also ask that you turn off your cameras. This is just to help us with managing the bandwidth, as we do have quite a few people joining us today. And but don't worry, after the demo there will be time for Q&A, and also I've got the sort of meeting chat box open, so I should be able to see anything that comes through on that. So if there's no issues with that, I will crack on and we can get started. The aim of the session today really is to give you a sort of general overview of the Shape tool and some specific examples of how it's been used in the COVID response. And this is mainly around two areas, one around service planning and management and understanding the assets and sites that we have in the COVID response and how we might mobilise those. And then secondly, around how we can understand the local needs of our populations and identify where our vulnerable groups might be, again, to help us plan and manage our responses for that. Now and also in the future, as I'm sure the COVID impacts will be around for a while. So to kick us off, if you don't know already, Shape is a web-based tool that's freely available. It covers the whole of England, but you do need to register for access that you can do from our website, which is shape.atlas.net. And to register for access, you just complete the user registration form. If you use your NHS account or your Gov email address, you will automatically be given access, and you'll be sent your username and password within a couple of minutes. It is sort of freely available. It's not publicly available, but we do allow and permit people like the voluntary sector or academic partners, or even some consultancies who might be doing a piece of work, particularly with an NHS or local government, can get access on a temporary basis as well. If you've got any queries about access, just drop us an email at the help desk, which is shape@phe.gov.uk. So it's a web-based browser, but you don't need any special equipment. We just say a decent web browser will help you get the best out of Shape. So once you get your username and registration, you can log in, and then you will see something that looks a bit like this, and it will have a map of England, and we have a couple of panels that I'll describe. In the middle you can see a map of England, and this comes with sort of CCG boundaries in there at the moment. On the left hand side is a bit of an information blurb, and this is where you'll get some updates. If there's any new data that's gone in there, or any key things we want you to know, we'll signpost that there. We've also got some useful guides and sort of other videos that you can watch there. On this right hand panel, it's where you've got choices about different data and sites that you might want to see on your map. And of course, in the middle, we've got a map which is zoomable and can sort of zoom in all the way to a street level view. You'll notice it there's a few things that will automatically pop up in terms of sites. So you can quickly get an overview of the sites that are here. Can I just check everyone can see my screen?
Barbara, you might want to unshare and reshare it because it's gone a bit funny on my screen. it's currently on your Teams. So if you press the rectangle with the cross in to stop sharing and then just reshare it again, it probably work on your Teams bit.
Does that work better?
Yeah, that's good. That's good now. Thanks.
So everyone can now see the map of England, yeah?
Yeah.
Good. Okay, so in this right-hand panel, as you can see, there's a number of sites that you can click on, and these are all the minor injury units across England. And if I tick that one, it will sort of pop up where the Nightingale hospitals are. So that's kind of just a across England view that you can get. So I don't know if you saw before, just quickly say these are the panels again. So this is the panel where you can get the information, and this is the panel that you can choose where to view data. So it's set up around sort of STP geographies, but it does include sort of CCGs and local authorities. So you can pick one from a drop-down box here, or click directly on the map. So I'll just pick one of areas in my patch, and it will go away, and you'll notice it will draw an orange boundary around, and that represents the ICS patch. So the data that you're going to see can be viewed across it will build up and combine those areas together. And then you can also switch to a local authority view if you'd rather see the data from that. And you'll notice now that the list of categories we've got to view data is has expanded. So it's not just those urgent sites. We've got primary care, secondary care, so that's hospitals and care centres. We've got things like care homes, children's centres, urgent and motor coaching, and some dental sites and dentists, opticians. So we've got various sets of assets that you can map. So I'll turn on GPs for now. This data all comes from the Organisational Data Service, part of NHS Digital, and it's updated every month. So most sites, should be in there. You shouldn't have problems. So as you can see, it's now mapped to all the GPs, represented by this green. That 8 means there's just 8 sites that are really close together. And if I click into them, I can zoom in, and that's Sutton, but it's actually, there are now 7 different GP practices all operating out of that one unit. And I can just like Google Maps zoom in and out to get a view. So that's all that 5 means. It means there's 5 sites close together in there. And if I tick something else, let's pick care homes, you can see where our care homes are. And again, this comes from the ODS, and it's also verified with the CQC data, so they should map quite nicely. And if I hover over them, you can see the name of them. Scroll down a little bit on this right-hand panel, you will see it's a site list, and that icon means you can export it. So if you needed a list, you can export that, and it will turn it into an Excel spreadsheet for you. Just go back to GPs. So as part of the COVID response, we were approached to see if we could help map the location of cold and hot sites. So basically those sites that had the resources and the PPE and whatnot to be able to take on patients. And so I've just, so we built this functionality that local people could actually set these themselves. So these aren't ones I'm going to show you now aren't real, not necessarily fixed, so we know that some of these sites have been set as hot or cold, and we've put little flags on them. So the red is hot, the blue is where it's cold. We've got options for fully open, or if the site is actually being closed. So this data isn't there for everyone. You have to kind of go in and set these yourselves. So if, for example, we want to see where the hot practices are, you can click on that and zoom in. If I click on that one, it can say it was updated and set as a hot practice back in 1st of April. If I can then change that as well. So if you know that that's now changed and you want to put it to be not set, you can do that, and then that will remove that icon. Similarly, so it's not just GP practices that we can do this for. We can do it for dentists. So if dental, we know in Cross Yorkshire and Humber, we're just working with them at the moment, helping set dentists as being hot, warm and cold sites. So you've got a bit of flexibility on how you want to code and classify those. So this practice has been set as hot. If you want to find out a little bit more about this practice, so it comes built with some other data. So we've got the catchment populations. So it will now think about what are the LOSAs, the lower super output areas, and the numbers of people in each of those that are registered to this GP practice. So actually, I'm just going to move that. Just show you, if I deselect that one by clicking on it, it will move. It will come back to where that normal view. I'll just pick this one. This has been set as a cold practice, and I'll just map. So the little button here. So that now tells me there are 541 people from this LOSA who are registered to this GP practice. And there's all the way, there's one person who lives out in this patch, happens to be registered to that GP practice. So you can kind of get an idea of the catchment population and the spread for each practice. And you can also do this for combinations of practices. So if I click on that one and then also add that one, you can start to build up combined populations as well. So you can do that. So that might be helpful for looking at PCNs. I'll just deselect that one. So as well as the kind of catchment populations, you can get another view of that, which is basically is the population pyramid. So you can understand the gender split as well as the age bands. We've got data around practice population, so this tells us how many GPs are in this practice. So in this instance, we've got 6 and we've got 5 that are full-time equivalents, and also the other primary care or GP practice staff. There's also some data about prescribing activity, and this is about what pharmacies were used to fulfill the prescriptions from this GP practice. And as you can see, about 40% of patients used the Lloyd's pharmacy, which happens to be probably in that as part of that GP practice. So it's very close by. Those green lines represent the other proportion of patients that are going into all these other pharmacies. So again, it just helps you understand the networks that those GP practices are part of.
Barbara, we've got a question just saying, can you show us what's in the workforce bit there? I think, is it the third button up from the bottom? Thanks.
Yep, so that's it's the counts of staff, and we've got them split by age bands, and this comes all data, it's all open source from NHS Digital Workforce data set. So it was last updated in December 2019, so it's a couple of months out of date now. So to get back to the map, I can just sort of select on there and deselect, and then I'm back to my full view again. So that was about understanding, you know, the practice. There's other things we can do about understanding the populations that might have access to these hot or cold sites. So let's, I don't really want to pick on hot sites. I'll pick on some cold sites. So these flags are the GPs that we think have been classed as cold. And if I hit this button, it will keep the map to only those ones that we've got ticked. So all the other sites have been removed. Now I'm just checking, can everyone see my screen still?
Yeah, can still see it, thanks.
Yeah, cool. So one thing we've got in shape is about travel time access. So if you've got a site, you want to understand who might have access or who's likely to make use of these services, you can use the travel time access, and we can look at it in terms of walking, cycling or car, or also public transport. So let's do walking by time. I mean, I'm not sure exactly what would be appropriate standard for access to a COVID site, but if we say walking for now, this has gone away and said, well, draw a little isochrone, which is this yellow shape, to represent how far you could walk in 15 minutes. So from this GP, that's the sort of how far you could get in a 15-minute walk. But importantly, it links it to data that we've got that sits behind here about the populations. So if I click that one, it tells me there are about 70,000 people in Hull who have access to these cold GP practice sites. And again, just to reiterate, this is not necessarily real, that has been coded as cold. This is just what we've kind of gone in for this demonstration. But in this example, it's telling me there are 70,000 people. This is the population who have access to those sites. And also this is the deprivation. So 61% of people who do have access are from the most deprived decile. So that's an important point to think about. But also we've got the opposite of that. So that is who excluded from these cold sites within a 15-minute walk, and you get that same information. Interestingly, less proportion from the most deprived decile, and a slightly different population makeup as well. So that means you can use this to test different scenarios. Again, I don't know what would be an appropriate standard about who should have access to a GP within a certain time frame. Maybe it's walking, you might choose its car. So this is an example of what a car, and you can see it zooms out because it actually can get quite far in Hull within a 10-minute car ride. For those cold sites, it's pretty much covering the whole of the population. There might be a few people out here who don't have access to one of these GP practices within a 10-minute car drive. We do have public transport, but I would say that it's experimental. What they are doing is doing a big web scrape of all the publicly advertised timetables of bus routes and trains. Now, obviously, during this particular period in COVID, a lot of those buses probably aren't running, or trains timetables have changed. But this is kind of based on what was sort of known that should have been happening at this point in time. So it does need some caution when using the public transport analysis. But again, you get the same sort of information. Roughly 166,000 people can access these particular sites within a 15-minute bus or train. Each of those little dots probably represents a bus stop. So that's the sort of access stuff, but it's also not limited to data that we've got. So if you were thinking about setting up a new site, it could be maybe a testing site, or there's a supermarket there that you want to do something with, you can use this option to drag a marker over, pop that into the map. Just let me turn it on. It should get updated. And then you can include that in your travel time analysis as well. So it kind of becomes a real site. Oh, it keeps disappearing on me. I've done twice now, haven't I? So if I click on that, I can give it a name. I can rename it. So it could be anything, couldn't it? It could be a testing site that we're going to set up. It could be a shop that's offering a service. Could be anything. But also you can then set it as being one of your COVID options. So if you know it's fully open, or it's a hot site, or a cold site, you can do that and then save it, and then it will stay in there as well. And if we don't need it, we can delete it. Okay, and delete. So that goes. So that means you can add your own sites and include that in any of your travel time analyses as well. So I quickly show you. You can see now it gets included as part of that analysis. I'm just going to go in there and delete it. And that will remove it. So I think that functionality is useful for a lot of things. People have used it to map potential housing developments, and then look at the impact that's going to have, what to the local GP practices or healthcare services that they're likely to use. Okay, so I'll move on now to the other sorts of data that we've got in SHAPE around understanding the population needs. I'll just turn off the sites there. So in the indicators tab, we've got a number of indicators, things like the age profile. So if you are for COVID response, maybe you're trying to target say you're over 75s or want to know where they are. If I click on the population pyramid, they'll appear here. I want to do combinations. I'm just going to do an Alt click on my computer, and then it will kind of add up those categories together. And then each of my lower super alpha areas are going to get coloured according to how many and what percentage of that population is aged between 75 and over 90. So you'll see now the interpretation panel pops up. It gives you an explanation of the indicators, a key there, the numerator and denominator, and also this sort of distribution chart, so you can sort of get a quick eyeball looking at the distribution within the patch. So the darker areas are the ones that have the higher proportion of older people. And if you quickly want to identify who they are, you can untick the other ones in your key, and then you're left with just those LOSAs that have that higher proportion. That's the distribution now, just those. It should go away in the map. Let me. It's gone slow. My kids must be on all their devices now. So they've got that data, so that's about the population. Just got to untick that, and then that will go away. We've also got deprivation. So if I click on this icon, which it says shows an internal indicator, that does the same thing. It kind of colours in each of the LOSAs according to the deprivation. If I turn on my GP practices, you can also now see, when I scroll down further, it will pop up with that indicator value for that for the GP practice where it is. So again, this might be helpful if you really want to quickly identify the GP practices or any site that you've picked that are in areas of highest deprivation. You can do that and export that, and that will tell you that list. So I'm just hearing, that's me just turning off the other one. So now you can see these are the LOSAs that have the highest deprivation in Hull. So again, this is about helping you identify the needs that we've got in our communities and demands, as well as where is our current service provision to help deal with that. So as well as deprivation, another data set I thought might be useful for COVID response is around identifying your at-risk population. So we've recently just uploaded some Acorn wellbeing data. This is just a bit of an experiment for us at the moment to see how this information works, and they very kindly let us have this information for free. So here you can click on the sort of the health challenged network, and it will again colour in the LOSAs according to those that have got a high proportion of the population defined as being health challenged. And if you want to find a bit more about their definitions or what they all mean, there's a link to their categories and how they derive those. It's essentially sort of a population segmentation data set that they've produced. And as part of this COVID response, have let us have this data for free. You might struggle to what you can actually do with this. You can't maybe post this on a publication and share it, because we are covered by some rules on data sharing. So if you need to check what you can and can't share, do let us know and we'll put you in touch with Acorn. But again, so you can hover over here and that give you a description of the LOSAs. So again, it might be that these areas are of concern to you, and it helps you identify, well, what are the services currently in that area? And then I just click to that to remove. So we've also got a few other data sets like hospital episode statistics, we've got ethnicity, QOF data. Within the layers tab, this is where we've got data that is sort of less interactive, sort of a bit more static, but they're kind of interesting data that people have sort of come across. One of which we just updated recently about fuel poverty. And actually, I'm just going to go in and turn off the GPs because that makes it look a bit crowded. So again, for COVID and our vulnerable communities, we might need to think about, well, where are our fuel poverty areas? And the ones in red here are the ones in the highest 10% in the country. This is it's a national indicator that we're applying. So you can see that the whole of the country gets coloured in. As a little tip, there is an option for map display options to, if you want to get rid of all that sort of other information that might be clouding it, you can hit that emphasize area and hit light in the outside. But then you can get a view about that was the fuel poverty one. There's also another one that's gone in recently about loneliness. This is from Age UK. And again, it's a sort of similar data set. You can actually have a look and find those areas that are in the highest risk. And again, we've highlighted the areas that are in the top 10%. We've got ones about population projections. We've got a series of environmental indicators, that visualizations you could have. And again, there's one about quickly identify what are your areas that are part of your high index and also part of your low, the lowest or the most affluent. Unfortunately, there's none in Hull. So that's the sort of example of different layers of data that you can go and map to understand what's happening in your patch. In sort of terms of a bit of a wrap up of that overview, there is a help desk. If you go into the info panel, so we've got an email, but there's also a live info panel. So if you need something or you get stuck, you can type us a message and someone will get back to you and should be able to help you out with your query. Where you see a little icon like a question mark, that just gives you a bit more information and a walkthrough of what that data is about. There is a video as well that will take you through all the other sort of non-COVID ways that people have used SHAPE. So I think that's all I wanted to cover. So that's the sort of the half an hour run through of shape. And I'm happy to start taking questions.
Barbara, we've got a couple of questions that came up throughout that I thought would be good to save to the end just in case you covered them. I think some of them you have covered. There's one about the capabilities around acute settings, because you did quite a lot with general practices, so it might be good to just go over that.
Yep. So we've got basically any facility or site that's an NHS site or facility is in shape, and there are thousands of them. So even in Hull, we've got the Hull University Teaching Hospitals Trust. So there's all sorts of sites that are in there. And it includes sites that aren't necessarily owned by the trust, but maybe a service operates out of there. That's why it can be a little bit tricky to map, because this is the data that we get from ODS. So it is, there's a lot of sites. So for example, according to ODS, there are these 3 acute service sites, but we don't know what they are. And that's why they've got the question mark, because we don't know if they're a health centre or what they are. So we just have to leave those as question marks. But yeah, we've got complete full coverage of any NHS site and facility. But if you want to control what you see in the map, you can use this function. So you can just turn them off. If you know that's not something that you're interested in, turn it off on your map, and the map will only keep on here the things that you've got ticked. If you have spent a bit of time clicking the sites that you want to see, because you know that they are the main sites. So here, for example, is our Hull Royal Infirmary. I don't know if you noticed, or you wouldn't have noticed, but the URL here keeps growing. And if I copy and save that, next time I paste that into my browser, it will take me exactly back to this view that I've just shown. So that's a little quick tip. If you have gone in and identified all the sites that you know you're interested because they are offering maybe these COVID wards, you can save that URL, and next time you go back in, it will reload to what you had saved.
Brill, that's really helpful. We've got some more on clarifying kind of hot and cold site flags. So yes. Kind of who does it and how often are they updated?
Yeah, so it's not something that we do. We've just given the functionality to allow an area to do it themselves. So if you go into your area, you might find that none of them have been classified. But you can go in and then you can set them as being hot or cold for your piece of analysis. If you want to save them so your colleagues can see them, you can save them. Shape will keep a note of when they were updated and who did it, so it will use your email address to identify that you've set them. But if you don't then want to keep them, just hit the reset them back to no setting, and then you can do it. So there is no one source, as far as we're aware, of sites being classified as hot or cold. It is a local determination, and obviously they might change. So it's very much a functionality to allow you to do the classifying.
Okay, thank you. We've got another question on what can you do around care homes. I think you showed this closer to the start, but if you could just show that again, that would be really helpful.
Yeah, so all we've really got on care homes is the location of care homes, and it's fairly comprehensive. There's a chance we might miss some, but if you click on them, it will tell you who they are. And again, you can set a COVID status to them if you have that information to hand. That will allow you then to do the other analyses we saw about flagging them. But at the moment, that's all we have on care homes is the location.
Hi, Barbara. Hi, it's Madassa. So can you sort of do the similar analyses, such as find out, for example, the age breakdown around the population and the deprivation and the hospital sites and so on?
Yeah, it's the same functionality. You select your site, and in the Access tab, you can do your walk distance for those, as well as actually, if I do just selected site, it will just do it for the one care home as well. So this is the population who has access to that care home in a 15-minute walk. If I do all sites, then it will go back to show me the same value for all the care homes. Yep. So that's
yeah, thank you. Thanks, Barbara. Fantastic.
Brilliant. So we've got a couple of questions on exporting the data and whether you're able to do that.
Yeah.
Next.
So a couple of things you can do. So the site lists here, they can be exported. And when I showed you when we had the deprivation, for example, by care homes, that can be exported, and you will get that data and that value. The other data that's really useful to download is the travel time stuff, because when you do a travel time analysis, so this is within a mile now. So you have to deselect the other numbers to get the analysis here. If I do that included population, there is an export button here, and it will export, see if it works, all the LOSAs that are within that catchment. So this is really useful because it means you can start linking it to any of the other data sets that you've got. So for example, if you've got data on outbreaks of COVID and you want to do something maybe that mapped it to the vicinity of a care home, I don't know, you could do that because we can tell you that these are the LOSAs that are within a 10-minute, what were we doing again? That are within a 1 mile radius of a care home. So you can then link that data to anything that you've got, as long as you've got LOSA code. So again, that's a really interesting piece of analysis that you could do yourselves, actually. But we don't generally export any other data. So the indicator stuff isn't really exportable because all that you can click through to the data directly yourself. So in that right-hand panel and interpretation, that link will take you to the data so you can get it firsthand. So we didn't really see a point in us sort of duplicating where you could get the data from. So we basically will signpost you straight through to the data source.
Okay, Brill. We have a kind of a question sort of linked to that about whether you can overlay local data on the maps in Shape.
Yeah, so you can't at the moment. Shape is not a normal sort of GIS tool that you might normally have. I'd say Shape is a tool specifically around, strategic planning, and we use GIS to help us get the message across. So we've invested in getting the right indicators and the core functionality in that we think you need to help you make decisions about service planning. Most areas do have their own GIS teams that can do those bespoke pieces of work. However, we do allow people to send us their data and upload their own, but that we probably would have to charge a fee. So I'm just thinking, for example, that all those urgent emergency care sites, for example, that wasn't routinely available. It wasn't in ODS, but a group within NHSE had that data and they wanted to see them mapped. They didn't want to bother having to build their own tool or mapping software. So they said, could we put it into Shape? And we said, sure. But there was a fee for them to do that.
And then if someone wanted to go about doing that, would they contact you,
yes.
the team, through the contact email that you showed earlier? Yeah. Okay, yeah. Brill. Okie doke, we've got loads more questions. That was brilliant, thank you. Have you got population density by ethnicity? So
we have ethnicity from the census data. So it's it's a bit out of date now. So this will be the percentage of each LOSA again. So you can see this is Asian and British Asian. So that's mapped in there. So it's just the census.
Okay, brilliant. And that kind of leads on to another question, which I assume is probably different for different data sets, but it says, how often is the data updated?
Yes, good question. So site data is pretty much every month. We get a feed from ODS and that will update the sites. The population data is usually annually. So for example, the population is from ONS mid-year estimates, and that's updated each year, sorry. So that's annual. HES data is annual. QoF's annual. Deprivation is actually every 10 years, I think, isn't it? When's the last of this? 2015. Oh no, it's 2019. Not too bad. So yes, it is variable. We tried to keep up to date. So, for example, the fuel poverty was the one that was only published not that long ago, a couple of weeks. So we put that in quite quickly. So yeah, it's different for each different data set.
Okay, brilliant. Thank you. And then there's a question about, can you show data by PCM boundaries?
Yeah, yes, in a way. We are about to build them in, sort of hard code them in for everyone. And this seems to be an area that we haven't done it for. But coming soon, probably within the next 2 weeks. Next time you click on GP practice, there will be another sort of set of function here, and that will all your GPs will be organized into your PCN boundaries, which means you can just select one PCN, and then just the sites within that PCN will appear. Some areas already do have them in, because again, this was an example of where someone had wanted their data in shape, so we had funded it and they put it in. But coming soon, we will have them for everyone in there. Yeah.
Okay, Brill, that's great. I think we've covered all the questions in the meeting chat. I hope that I've covered them all. But if anyone wanted to unmute themselves and ask a question, please feel free. I just wanted to highlight before then that someone's put in there about offering shape training, and there's an email address that's been put in the chat box about how to access that. So yeah, if anyone wants to ask a question, please go ahead. It sounds like we might have covered everything, Barbara, with 2 minutes to spare, which is great. So great session. Thanks, Barbara. I think that's really useful, and yeah, answered all the questions. So yeah, thank you very much.
Yep. So if you're interested, just contact the help desk or sign up for Shape yourself today.
Brilliant. Thanks, everyone. Goodbye.
Thank you. Bye.